So I'm going to ask Dr. Navina Evans, our Chief Executive Officer, and Dr. Kevin Cleary, our Chief Medical Officer, to close the conference.
Thank you very much, James, and thank you very much, everybody. I promise it's me, Navina, then lunch, so you'll be gone from here in about 5 minutes. When I see all that has been achieved by our great staff, I do think, gosh, when we started this work 3 years ago, it was a leap of faith for us. No one had really done this in this way in mental health, and that, of course, was a great opportunity for us because we could sort of make it up as we went along. But also, because no one had done it before in this way, there was no one really to show us and guide us how to do it. What a day like today is about sharing with people from within the organization, staff, patients, service users, but also people from outside of the organization, the work that our staff have been doing, the staff who deliver the clinical services have been doing, and showing us how you really can improve the quality of care that you're providing so that you have happier patients, happier staff, a nicer place to work. I came back about 3 weeks ago from a holiday in New Zealand. I'm from New Zealand originally. And as part of that holiday, I spent 2 days doing some QI work, and I realized it's slightly tragic that I would be doing QI work on my holiday. But it gave me a real sort of sense of how much we've achieved, how lucky and how proud I am of us as an organization. You often hear in the NHS, we want to be a learning organization. Well, actually, this is what learning looks like. This is what effective, real learning looks like. Sharing, hearing the opinions of others, showing what other people are doing. The other thing I think about a day like this is that actually it's a challenge to the wider NHS, because there has been an NHS way of trying to improve quality, which has been very top-down, performance management driven, okay? I don't think it's delivered, okay? And we are challenging the wider NHS to look again at how you can do this, to see a different way of doing it, and to actually show people that actually trust your staff, believe in them, they know what to do, if you nurture them in the right way. Navina.
Thank you, Kevin. I hope you've enjoyed the morning. I certainly have. I want to thank you all for being here. And I also want to thank I've noticed that we've got friends from other trusts, other organizations, commissioning, role-free, BARTs, lots of people. Great to see you, and thank you for joining us. I think it's really important for me I can't stress how grateful I am to all our staff for trusting and for embracing this whole process and way of being and way of working. I really do believe that focusing on improving with what we've got in the current climate of the NHS, where it can be really demoralizing if you let it, is got to be our narrative in the Trust. And I want to thank you all and our colleagues who are not here today for believing in this and doing this work. I particularly want to thank our patients, carers and service users. If people who weren't able to be in that session, can you watch it? Yeah, okay, please do, because it was amazing. And one of the things that I kept thinking, I can't believe how or why, but please don't stop. Patients, service users and carers want to help us make things better. Especially, I heard about someone who basically was so dissatisfied with our complaint system that didn't deliver for her issues. I don't know where you are if you're in the room, but never mind. That you wanted to, instead of sort of going to the ombudsman and all that stuff, you wanted to get involved in helping us to make it better. It's still not fixed, But that is just amazing. So on behalf of all the staff in East London Foundation Trust, I want to thank our service users, patients and carers for helping us with this. And please, can you get more people to help us with this? Thank you. Two more things. Breaking the rules. That's been great fun. If you haven't voted for the rules you want to break, please go and do so. I had a look at them, and I must say I'm a little bit ashamed at some of the things we make people do. So we're going to stop, and we need you and other colleagues to hold us to account to make sure we actually do stop some of the ridiculous stuff that we make you do. So that's look out, watch that space. And finally, I want to say that things are changing for all of us. We have a role to play in a system, which is, and Derek spoke about moving into population health and looking after our communities. And we're going to be doing that going forward with health and our colleagues in social care and our other partners in our communities. And we welcome our new colleagues from in Tower Hamlets Community Health Services tomorrow. Really excited about that. So that's really great. And in order to do that, we probably need to shift a little bit as an organization and our strategy and how we work and what we need to focus on and how we're going to use QI to help us in the system. So we're going to be starting what we're calling big conversations with all of you and our other colleagues and patients, carers, service users. And so you look out for those. And I have no idea what will come out of them, but that's part of the point. And we're going to be doing that over the next few months because it'll help us to plan how we want to work in the future. So thank you very much for participating today, and enjoy your lunch and keep improving.